Good afternoon, everybody.
Good afternoon.
My name is Brother Jeffrey. I am the supervisor of the Torchlight Engagement Team. Torchlight is a newer 501c organization that is currently in the Grove Hall area at 2 Washington Street. We recently just opened up a recovery center / recovery cafe, and that is open to everybody, and it is definitely a beautiful thing for the community that people are taking advantage of at this time. We also have an engagement team in Nubian Square, a Torchlight engagement team. And it's 5 brothers who on a consistent basis from 9 a.m. to 7 p.m. are in the community engaging those who need our assistance, coming from a lens of love, respect, and non-judgment, and doing all in our power to connect them to a bunch of the resources that are in the room, some that are not. But any way that we can assist, that's what we're doing in the community, to the best of our ability. I am also on the Nubian Square Task Force as a member of the leadership team. That team consists of a few organizations, Healthcare for the Homeless, Mass General Hospital, and it's led by Sister Katrina, who's going to come up after me from Boston Public Health Commission. So this group of people and the people that attend the meetings is essential because one thing that the people in the community need is help. This meeting is dedicated to strive to connect the dots, connect the organizations that may not have outreach teams to those that need their resources. Connect the organizations to what's happening in the community. And specifically this meeting touches on Nubian Square, but it really encompasses Boston as well. Currently in Nubian Square and in the city of Boston, there's a crisis, an opioid epidemic, and it's something that needs full attention, which is occurring from multiple organizations. But here in Nubian Square, we are seeing people overdosing on a continuous basis. We are seeing people not only that are currently struggling with substance use disorder, but also their families suffering from what's currently happening. So we are dedicated, I can speak for those on the leadership team, dedicated to assisting. I can speak for Torchlight, dedicated to assisting in any way we can. And today we're here to talk about the Family Overdose Support Fund. And at this time, I'm going to bring Sister Katrina up to go further into that. Thank you.
Let's give Brother Jeffrey another hand. Thank you, Brother Jeffrey. First of all, I just want to really say that I'm really, really, really grateful to have a team such as the Nubian Square Task Force today and every other Wednesday, and not even every other Wednesday. Some of them are outside doing the work directly and coming back and reporting and trying to build a healthier, to enhance the quality of life in Nubian. So thank you to every member. And we've been meeting for the last 2.5 years under the leadership of my facilitation. And we've been doing, I think you guys have been doing a great job, a really great job. We're fighting against the forces of drug addiction, drug selling, and homelessness, mental illness. And we also have other teams that are helping us with this project. So I will not be before you any longer, but I do want to just say that today we're here to discuss the Family Overdose Support Fund, a new program that will provide financial aid to families who will have lost a loved one to overdose. This initiative is made possible through the opioid settlement funds. Dr. Ojukuta will share more about this program and also give an update of the overdose trends in Boston. Then the fund administrator of Boston Bullpen will present more in detail about the application process. This program means a lot to me personally. Like many of you know, I have lost loved ones to overdose addiction. Opioid overdose, sorry about that. Nothing can take away the immediate fallout and pain that comes from unexpected loss, but at least this program can help ease some of the financial burdens that people suffer from. It is also deeply meaningful to announce this program here in Nubian Square, one of Boston's historic Black neighborhoods. Equity is at the heart of everything my team at the Boston Public Health Commission does. And this program is no exception. We're being intentional about reaching communities disproportionately impacted by overdose crisis, especially Black and Latinx. I'm also proud that Dr. Ojukutu was enthusiastic about choosing this location for today's announcement. I've had the honor of working with her for many years, dating back to my time working in the HIV field. Dr. Ojukutu has a long history as an infectious disease physician and health research. And I've always, we good? We good? Okay. And I've always admired her strong belief in the power of the community engagement as the cornerstone of public health. Before I hand it over to Dr. Ojukutu, I would like to acknowledge a couple of people from the Boston Public Health program to life. Michelle Clark, are you in the room? Michelle? Mr. Christian Arthur. Yes, Christian, Christian started out with me here working at the Nubian Task Force. He was one of the ones that actually helped write one of the first surveys that went along, and we wanted to make sure that the transit folks understood some of the functions of 311, how to use emergency, when not to use it. So thank you, Christian, for that. Finally, I want to thank the Mayor Wool and Dr. Ojukutu for their leadership and commitment to addressing this long-standing gap in supporting families impacted by overdose. Your visions ensure that families struggling with costs like funerals and other expenses finally have the help they need. Now let's welcome Dr. Dr. Bisola Ojukutu. Sorry about that.
No, it's fine, it's fine. Most people just call me Dr. O or Dr. B, so it's fine. Good afternoon, everyone. Okay, as Katrina mentioned, she and I have worked together probably for more than a decade, providing outreach, education, prevention, linking people to care who were either newly diagnosed or at risk for HIV infection at the Multicultural AIDS Coalition. I just want to thank Katrina for her decades of dedication to service to the people of Boston, particularly in our Black and brown communities, particularly those who've been disproportionately impacted by homelessness, HIV, substance use disorder, all these intersecting epidemics that we continue to grapple with. And don't you guys forget that February 7th is National Black HIV Awareness Day. Okay, so let's not forget that we have another epidemic out there. And again, like I said, these are intersecting epidemics. Okay, so I'm really honored to be here with you today to celebrate not one, but two wins for our community. Both of them are a result of your hard work, the people right here in this room, your commitment, your dedication to ending the drug use epidemic and the overdose mortality problem that we have in our city and beyond. So the first of those wins is the launch of the Family Overdose Support Fund. You know, probably about a year ago, and a lot of this was led by Christian and other folks at the Boston Public Health Committee, we did this very extensive community engagement process, and we heard from hundreds of Boston residents, advocates, people living with substance use disorder, and organizations, institutions, hospitals. And what we heard from them was that if we're going to use the opioid settlement dollars in any way that's most meaningful, then we need to allocate money first and foremost to families who had lost loved ones. Mothers, fathers, children, parents who, you know, were left behind and suffering from loss, and not only suffering from the tragedy of loss, but also struggling financially. So the city and the Boston Public Health Commission have committed the initial portion of our opioid settlement dollars, $250,000, to support this fund. And what we will be doing is providing up to $5,000 per eligible family in direct funding to those who have lost a loved one. This money, certainly, as Katrina already said, this doesn't take away the pain of losing a loved one. What it does is it supports the costs that I know that are burdensome. I myself and my own family have lost individuals to substance use disorder. Funeral expenses are exorbitant. Counseling, child care costs, legal services, legal expenses. All of these things can be funded by this $5,000 per family. So I want to thank you first and foremost for the engagement. Like I said, it's many of you in this room who were participating in that process. process, but also want to thank Mayor Wu, who wanted to be here today. Boston Bullpen, our partners in this process, a nonprofit organization that specializes in providing these type of financial aid services to those in need. And certainly Elsa Gomes and Brendan Little, who have been our partners in other ways, but certainly will be working on this fund, and you'll hear from them next. I also want to thank the Nubian Square Task Force, so all of you in this room, our recovery services team, the red shirts over there, plus lovely CRT, also in red. We're all one, we're all a family. And all the individuals who advocated for the creation of this fund. So it's really an exciting day. And my understanding is that this is one of the first times that a fund like this has been established across the country, so it really is something to celebrate. And I just want a round of applause for the fact that we are establishing this fund. Okay, so I said that there are 2 wins. Okay, so the second win, if you recall, from 2022 to 2023, here in Boston, we noted an increase in fatal overdoses, while across the state, you probably recall that they noted a decrease. So the good news is that last year, we looked at data from 2024, and there is an unprecedented decrease in overdose mortality across our city, greater than any that we've noted in the epidemic here in Boston previously. So what we did was we compared data from May through August of 2024 to that same time period in 2023, and we found that overdose mortality has decreased 40% across the city of Boston. Among Black residents, decreased 56%. Amongst Latinx residents, we noted a 28% decrease. And honestly, when you look across all demographic groups, younger Bostonians, older Bostonians, men, women, we noticed a decrease in overdose mortality. These data are preliminary, but I wanted to share them with you anyway because this is a big deal. And it's not just about, factors related to potentially the drug supply and other things that people have talked about. It really is because of the work done by people in this room. It's about your work to decrease substance use stigma around the city of Boston so that people feel good about going in to get help, feel good about asking for assistance. It's about increasing access to naloxone, which we've done across the city, done with the help of many of you partners in the room. It's about ensuring that people with substance use disorder have access to housing where they can get help once they have a roof over their head, and harm reduction tools like naloxone, but other harm reduction tools also. Your work to navigate people to detox and recovery services and really get people through a very complicated system that can be difficult to actually navigate. Your work has changed the trajectory of overdose mortality in the city of Boston. So I thank you for all that you've been doing. This certainly is not a victory lap. There are many people out there who are still suffering. As we all walked into this building, you see people on the street, you see people who need help, you see people who want help, and we need to continue to reach out to them. We need to continue to do the work that we have been doing. So we have a lot of work to do, but I believe that together, in partnership and in collaboration, we'll continue to make progress. So thank you again for all the work that you have been doing, all the work that you will continue to do, and congratulations on these 2 wins.
Good afternoon, everybody. My name is Brendan Little. Nice to be here with you all. Thank you so much to the Nubian Square Task Force for hosting us. I'm very grateful for you all. I know that this is a little bit different than your usual meetings, so thank you for having us. Yeah, I'm really just so excited to be here today as somebody who's worked on this fund for a while and has cared about this issue for a long time. I am going to be, along with Elsa, co-managing the fund and getting all the applications in, getting money out to people who need it. And we've been advocating for this for a long time in various ways. And I think whenever we would bring it up, sometimes people would be like, oh, that's nice, but that's too sad. Or, that's after the fact. And I think that what they didn't understand that investing in somebody who's just lost somebody to overdose can be a form of prevention. It can be a form of intervention. It can be a way to disrupt patterns of addiction. I'm a person in long-term recovery myself, so I know how much a little bit of money can go When I was in early recovery, I wanted to go to UMass Boston. I had dropped out of school. I was trying to get my life together. And I saw that the fee to apply was $200. At that time, I didn't have it. I was just out of homelessness, struggling, and somebody lent me that money. So I know how life-changing these seemingly small grants can be for people who are having a hard time. So we're so grateful to be here. Thank you so much to Dr. Ojukutu, the Health Commission, Mayor Wu, Christian, Katrina, the whole team. The outreach team here is amazing. Just want to give those guys an extra shout out as well. I've seen their work. I've been along with them many days, many times, and I know how much work they do, and so much of what Dr. Ojukutu was talking about was because of their efforts. So with that, I'm going to introduce you to a couple other people on the team and then do a quick presentation, and that'll be it. So without further ado, I'm going to introduce you to Steve Alperin, the founder and director, president, something important, at the Boston Bullpen.
Thank you very much, Brendan. And thank you, everybody. Thank you for being here. Thanks for having us. We really appreciate everything, all the support from BPHC and the city of Boston to get this going. It's been a lot of work, and especially my two colleagues here, Elsa and Brendan, have really put in a ton of work, and we're just happy to be able to collaborate with them. Boston Bullpen, I'll give you a quick nickel version of Boston Bullpen. We started in 2017. Myself and the other three founders were good friends of mine, Ben Levin, Michael Conley, and Alan Stern. And really what we started with and what we've been doing for the last 7 years, actually, yeah, 8, is crisis resolution in and around the Boston area. We do this by partnering with social service organizations. We started with 12 in our first year, and right now we're almost at 90. And so what happens is with these organizations, and they're all wonderful organizations, but as you know, they can't do everything. And so where there are gaps, mostly by budget, could be by mission, could be both, they will come to us and we will approve it, obviously if it fits with our mission, and we will facilitate it within a 24, 48-hour period. And that has been really successful, and I think the key is going through the organization, which really speeds it up. So over that time, we've received almost 2,200 requests. We've helped about 7,500 people, and we've distributed about $1.6 million. And so that's since 17. And then I was fortunate enough to meet Elsa in 2020, and together with her and Brendan, we've collaborated on several requests. A lot of them dealing with the same issues we're going to be dealing with the HALO initiative and the Family Overdose Support Fund. So, and again, it'll be the same process. I almost look at Brendan and Elsa as our partner organization. They'll come to us with a request, and we will plan to facilitate this within 24, 48 hours. There'll be no exceptions. It'll be the same sort of process protocol as we've been doing for 8 years, and specifically with the last 3 years. So we are really excited for this day, and I do really want to give a shout out to Brendan and Elsa, because other than being great people and great partners and collaborating with them, they've put a lot of hard work, and they've advocated for it. They facilitated it with the cooperation of the city and BPHC. So we're really excited to get going and continue the work we've been doing. So again, thank you to everybody. Really appreciate it, and I'll pass it along to Elsa. Thank you.
Hello, everyone. Good afternoon. It's good to be here, and it's really an honor to be with you all and to stand with so many leaders that have tirelessly supported this issue in the community and are working daily to make lives better for others. That's also been my mission. I've always worked for nonprofits, so I know how hard this work is, and I've been a fundraiser my whole career, so I know raising funds for things and for people that other people might not think or deem worthy is really hard. So I make that my mission. All your work represents the best of our community, the resilience, the determination, and the fight for dignity and justice for people every day. I've, again, like I said, spent my whole career in this intersection of nonprofit work, seeing direct services, or even advocacy. Most of my work has been in philanthropy, but on behalf of organizations that serve immigrants and refugees. People always ask me about this project because I'm so passionate about it. Why do I care? Or, if I had something personally happening to me and my family that brought me to care so deeply about this issue. And for me, we don't really have to experience tragedy ourselves to be able to care about others. It's not about that. We don't have to have the fight to be able to fight for others and understand what they go through. I have actually a mug that says, it shouldn't have to happen to you for it to matter to you. And this morning I was having my coffee, I'm like, okay, this is the Latin for the day. That's what empathy is, that's what philanthropy, which means the love of humanity. That's what it means, and that's what it's all about. I wanted to really, really thank all the people that have been involved in bringing this together, from the team at BPHC, from the Mayor Wu and Dr. Basola for the support. We've been, advocating for something like this to be created for years. And what an inspiring outcome this is. After years of advocating and partnering and bothering a lot of people, to see that we're coming here today to celebrate meaningful change is really, really good. It's a time that we are seeing harmful policies and cruel policies, demonizing people, putting people down, and this conversation today, this here is a victory for people and to help the community. And it's rooted in the community and the feedback that we heard from the community for this to be created. So I'm really proud of this change. My journey with this work started because by being a fundraiser, I knew what it was like to sit in front of people and ask for money for causes. And I always vowed to myself that if I ever had the opportunity to become a funder and give money out, I would do it in a different way. So that day came, and in 2020, I created the Social Equity Access Fund, which is the fund that I manage right now. And at the time, it was a direct cash assistance fund because we were during the pandemic. People needed money for groceries, people needed money for things, and we were able to, do that quickly. But then it evolved to really helping nonprofits because we know that they're on the ground. You guys know who needs what, and so it's easier to give the money to you and let you do it. But I really wanted to be done different than what I had experienced. I wanted to be kind of the donor I never had. And I wanted to give money unrestricted to organizations to do good things. So when we started getting a few requests about paying for somebody's funeral because of opioid addiction or substance use, I gave the money for the funerals. I partnered with Boston Bullpen. Steve helped me kind of navigate and connect to those organizations as well as Brendan, who has been my guide through this work. And every time we would pay for a funeral, I would think, okay, so the funeral's paid, but what happens to that family, right? What happens to those kids? There was one funeral in particular I remember we paid for, and the person had 6 children. And I always thought, okay, we paid for the funeral, but what happens after that? The families, grandparents, whatever it is, whatever needs that they have. So I really just want to make sure that this issue continues to be in the forefront of people's minds. It's like Dr. Basola said, the intersectionality of all these issues coming together, poverty, being an immigrant, whatever other things are. Lastly, I just wanted to say that the work of philanthropy should really be about what the community needs and presenting that to the community. We say that Boston is resource rich and connections poor, and that's true. So when we make these connections between ourselves and we have the resources to do what we need, that's really what we should be doing in the first place. I'm a proud daughter of Cape Verdean immigrants. I grew up in Portugal. I was born and raised there and moved here for school, but you live here in the middle of the Cape Verdean community as well, and you know how generous those people are, and that's how I was raised. I was raised with everybody and their mothers living with us and just helping everyone that we could whenever we could, even though we didn't have much ourselves. And so when I think about what it is for a family to lose a loved one and not be able to give the last part of dignity that they need, which is just to be buried. Everybody's born, everybody dies. We all need to go somewhere. And the fact that people would struggle with that was really hurting my heart. And so the fact that this pays for the funeral and the other needs that the families may have and that can service their children is really heartening. So I just want to thank everyone, especially Brendan. Thank you for your friendship and just guiding me through this work and showing me how to do this work in a really meaningful way. And Steve, and all the founders of Bullpen Project, Ben Alperin, Steve Alperin, Ben Levin, Michael Conley, and Dr. Alan Stern, who is a physician, a pediatrician, but has had people that have grown up and then died of opioids, so he really understands the work from that sense. So thank you so much. From what we know, this is the first fund of its kind in the country. If somebody else knows different, please tell us, because we've been looking for other funds like this. But from what we know, other funds only help other things, but not the families. So we're really excited about this. But this is really the foundation. It's really the beginning. So please join us and link arms together with us, because standing this fight, we need each other, and we need to help one another. So let's keep going. And I'll pass it back to my friend, Brendan Little.
All right. Everybody see this okay? All right. Okay, so Elsa, thank you so much. This is a very brief overview of what the fund will do and kind of, what it is and eligibility. It's not very long. It's really just high level. If you have more questions, I'm happy to stick around till anybody who wants to talk to me, happy to talk. I know our team will be here as well. So with the Bullpen Project, Boston Bullpen Project, we've started this thing called HALO Initiatives, which will be this kind of umbrella organization that will help people who have lost a loved one to overdose. The first thing that we're doing is this fund, is the Family Overdose Support Fund. And what we really want to do is aim to support people, not just with, okay, there's a funeral that needs to be paid, great, but also really trying to invest in people to think about their long-term health, recovery from trauma, thinking about interrupting these cycles. If we think about where this money's coming from, it's coming from opioid litigation, right? So this is coming from lawsuits that the city and the state and other municipalities have had where they sued the pharmaceutical companies that engaged in a lot of illegal practices and immoral practices. So if you think about how generations were lost because of that, we're really trying to think about this money as a generational solution as well. So while it's just getting started, we have a lot of big plans for it. And we really aim to start with the financial piece, and that being really key. So the inaugural fund is Family Overdose Support Fund, which we're all here to celebrate today. It's a partnership between the City of Boston, Boston Public Health Commission, and Boston Bullpen Project. Thank you. And the focus areas, so we've started out on 4 focus areas that are the main focus for now, which is legal fees, and that pertains to legal fees, I'll go into that in a sec actually. Legal fees, funerals, child wellness, and behavioral health. So those are the 4 areas we've identified through a lot of discussion and a lot of work, and you got the bowling building right there, just nice. So when it comes to the funerals, funeral costs, cremation costs, for child wellness, therapy, be it individual or group therapy, anything that's kind of clinically based, extracurricular activities such as sports, music, dance, summer camp, which could include like a grief camp, which exists for people who've lost a loved one, for kids, individualized therapy, group therapy for behavioral health, and then legal fees pertaining to the person that they lost. So if there's something having to do with an estate or custody or wills, anything like that. So the eligibility overview. So the applicant must have lost their family member within the last 2 years. And the deceased must be a spouse, father, father-in-law, mother, mother-in-law, brother, sister, child, grandparent, grandchild, legal guardian, or other member of the applicant's immediate household. And the applicant must be a Boston resident for this specific one. Sorry, I don't know, this is looking a little crazy, but it is what it is. So one thing that the Family Overdose Support Fund does not do is it does not do direct cash. So the way it works is to cut down and make sure that everything functions properly is to pay the service on the person's behalf. So if there's a funeral invoice, the person will share, and this is something that we've done many times already. We've paid for 16 funerals in the past few years as a team. They'll give us the invoice from the funeral home and we pay it directly. So that's the way that it'll work. And the same thing with all the other services that it'll provide. And then what to expect after you apply is within 24 hours, somebody will get back to you. And then within 48 to 72 hours after you've been approved, it will be paid. And that's it, really. That's me. Sorry, I don't know why this looks crazy. But I have business cards, and I'm happy to, that's my email and phone number up there if you want to reach out. Happy to speak with you all. And thank you, everybody. Thank you so much again to the Health Commission and to the City of Boston and to all the amazing partners who informed this. This is something we've cared about for a long time and have been really advocating for. So grateful for everybody. This is a team effort, and I've never seen one, you know, and as Elsa said, we're in a national climate right now where there's a lot of people who are trying to tear people down or break things apart, and this is a perfect example of a community coming together to solve a problem. So thank you all.